This presentation is going to discuss the board position statements that were updated at the 2023 January board meeting. As a reminder, the board position statements do not have the force of law the same way the NPA and board rules do. However, they were created to provide direction to nurses on issues of concern to the board that are relevant to the protection of the public. Keep in mind that these position statements should be read and the guidance they provide is in their totality, meaning don't take out a single sentence or a paragraph, but really take the context of the entire position statement. Board position statements are reviewed annually for relevance and accuracy of the current practice, the NPA, and the board rules. This most recent review and board approval occurred in January of 2023. As you can see here on this slide, there were many position statements that were brought before the board in January of 2020 that had no changes. That means the text, the concepts, the content all remained the same, and the board approved those remaining the same. In addition, there were 5 position statements that were brought before the board that did have changes. You can note here on this slide that 4 of them had non-substantive changes, and 1 did in fact have substantive changes. We're going to talk about these a little bit more on the next slides. Of position statements we're going to discuss are those with non-substantive changes that related to the resources. That means in each one of these, it was the resources that were actually updated and were a non-substantive change. So in position statement 15.3, LVNs engaging in intravenous therapy, venipuncture, or peripherally inserted central catheter or PICC lines, changes were made to reflect an update to the references. In 2021, the standards of practice related to infusion therapy were updated in the Journal of Infusion Nursing. This new publication does not change the meaning, intent, or use of this position statement. However, it does provide clarification to nurses that the position statement remains consistent with the latest infusion therapy nursing standards. Position statement 15.12, use of the American Psychiatric Association diagnoses by LVNs, RNs, and APRNs, includes a change to include the most recent version of the Diagnostic and Statistical Manual of Mental Disorders, or the DSM. The latest version of this publication does not change the meaning, intent, or use of this position statement. However, it does provide clarification to nurses that the position statement remains consistent with the DSM 5th edition text revision. Lastly, position statement 15.30, or workplace violence. This includes changes that reflect the update in the title of a referenced organization and edits for the location of the resource document within the newly restructured organization. The American Organization of Nurse Executives has recently changed their title to the American Organization of Nursing Leadership, thus updating their co-developed toolkit for mitigating violence in the workplace with the Emergency Nurses Association to a 2022 version. The latest version of this publication does not change the meaning, intent, or the use of this position statement. However, it does provide clarification to nurses on the location of the referenced material. The last non-substantive change to a position statement occurred to position statement 15.8. This change was made for clarification. Position statement 15.8, role of the nurse in moderate sedation, has changes that are intended to provide clarity to nurses when providing moderate sedation to patients. Board staff have received numerous inquiries this past year relating to this statement. The clarifying statements that were added to this position statement surrounded the loss of protective reflexes, an update to the FDA product label for propofol, and the availability of necessary support when providing specific types of sedation. Additionally, broadening the position statement's wording on the use of new technologies related to sedation. Research does not show that recent use of the FDA-approved computer-assisted personalized sedation system is not currently in place, but that does not mean that similar technology might not be used in current practice or be developed and incorporated into a nurse's scope of practice in the future. Again, these updates do not change the meaning, intent, or use of this position statement. However, the changes do provide clarification to nurses surrounding their role in moderate sedation. The last position statement that had changes at the 2023 January board meeting was position statement 15.14, which had substantive changes. Position statement 15.14, duty of a nurse in any practice setting, has always addressed a nurse's duty to their patient in any practice setting. Though the Advanced Practice Registered Nurse, or APRN, is required to keep their registered nurse license as the foundation of their APRN license, and therefore was always addressed in this position statement, the updates to this position statement now reflect the inclusion of the APRN more directly throughout the discussion of a nurse's duty. I hope this presentation helped to clarify any of the changes that were made at the 2023 January board meeting related to the board's position statements. On this slide, just as a reminder of where the position statements are located, they're located under the Practice tab. When you hover over that, a drop-down menu appears. A little bit more than halfway down, there's BON Position Statements.